Let's get it. This is Life's Essential Ingredients with Jeff and a Mike, where we hope to inform, inspire, and transform lives, one essential ingredient at a time. Welcome to the show. Good morning, everybody, and thanks again for tuning in to another episode of Life's Essential Ingredients. And boy, do we have some essential ingredients today. No joke. Get out a notepad. Get somewhere where you can really focus and listen in, because we have an incredible guest, Dr. Roseann Capanna-Hodge, coming all the way from Ridgefield, Connecticut, who has spent her life helping people perform to the best of their ability. I'm just going to say that, and to keep life simple with some very cool tools to help us stay focused. But before I get ahead of myself, good afternoon, Dr. Roseann. Good morning. My Pasha, I'll just let you two say hello to each other real fast.
Hello. Good morning.
Good morning, Dr. Roseann, and thank you so much for being on the show. We are so excited to have you today.
Well, I'm excited for this conversation with you guys. We've already had fun pre-conversation.
Oh, yeah, it's going to be good. Going to be good. So about our guest, again, she's coming all the way from Ridgefield, Connecticut, and just a real quick little tidbit on that. My wife and I were just out in Fairfield, Connecticut a couple weeks ago for a wedding at Fairfield University, and we had a driver, this amazing man, John, who was from Ridgefield, and he loves it out there. So crazy how small the world is sometimes. So first of all, where you can contact our guest, and again, it's Dr. Roseann Capanna-Hodge, and you can find her at www.drroseann.com is one of them, drroseann.com. Also at www.childrensmentalhealth.com. Let me say that one again, childrensmentalhealth.com. She has some incredible resources on her website. So about our guest, and a quote on her site: changing the way we view and treat children's mental health. And I love that in itself. So much to unpack with just that statement. Dr. Roseann is a trailblazing psychologist, pediatric mental health expert, and the founder and director of the Global Institute of Children's Mental Health. And Dr. Roseann and Associates, that's her company. Her Connecticut-based center has helped thousands of children and adults reverse the most challenging conditions, such as ADHD, autism, anxiety, depression, concussion, learning disability, Lyme disease, and PANS and PANDAS, which we're going to explore, because I'm a nurse of 29 years, not a pediatric nurse, but didn't have a clue of what those were. And it's going to be just some good knowledge today. Dr. Roseann treats these conditions using proven holistic therapies, love that word right there, such as neurofeedback, biofeedback, psychotherapy, and nutrition, using her trademark intensive 2-week intensive 360-degree Reboot Program. Her mission is to teach parents how to reduce and reverse their child's symptoms using proven natural therapies. Again, just love, if you're really listening to these words that she's using, just incredible stuff coming out right out of the gate. Dr. Rosann's book, It's Gonna Be Okay, and course, the Get Unstuck Program. I love just your titles that you use. The step-by-step way to change your child's mental health. Give parents the tools for lasting change. I'm going to say that again. Give parents the tools for lasting change. She is the author of Teletherapy Toolkit, Therapist's Handbook for Treating Children and Teens, and co-author of the best-selling book, Brain Under Attack, a resource for parents and caregivers of children with PANS, PANDAS, and Autoimmune Encephalopathy. She has been featured on dozens of media outlets such as the Mel Robbins Show, Fox News, CBS, NBC, PIX11 NYC, Cheddar TV, Forbes, USA Today, Yahoo News, WebMD, Business Insider, Parents, The Week, and the New York Times, and most of all, Life's Essential Ingredients. Let's get down with Dr. Roseann. Thank you. Dr. Roseann is a Connecticut certified school psychologist psychologist, a licensed professional counselor, certified integrative medicine mental health provider, and a board-certified neurofeedback provider. Dr. Roseann serves on the boards of the Northeast Regional Biofeedback Society and is a Lyme Connection Task Force professional advisor. Dr. Roseann received her Bachelor of Arts degree in psychology from Central Connecticut State University and her Master's and Doctor of Education in educational psychology from American International College. Dr. Roseann also has her own podcast, which is amazing, the Parent Coffee Talk. Please check that out. Most importantly, Dr. Roseann has 2 children and walks the walk of being a parent. Dr. Roseann, welcome to the show.
Well, holy moly, you read the whole bio. Thank you. And, I'm a mom of 2 special needs kids, so I love to share that with people. And yeah, I do walk the walk. Parenting is the hardest and most rewarding job. And when your kid struggles in any way, shape, or form, it is harder. So I'm looking forward to this conversation and the deep dives we're going to do.
Yeah, no, it's going to be amazing. And I love I just love the words that you use, first of all, and just the practicality of everything. And I also just love how you just said job, because I like to use that in, saying that I'm married, and it's one of the most challenging and most rewarding jobs. I have 2 children, is a job in raising them. And I think sometimes we don't look at these parts of our life as work. And so if you don't look at them as work, we're not going to put in the time into having a successful marriage, raising successful kids, whatever that means. But we always kind of put our effort and our energy into our job, whatever that is, our profession, and then we don't have much left for the most meaningful, the most essential jobs. And so, I love that. And I thought about cutting down your intro, but then I was like, there's just so much, and you do so much, and you're committed to all these different boards and aspects of your life to help families and adults, again, be the best they can be. So it's going to be great. I want to quit talking, but I do have our thought of the day that is going to get me talking a little bit. Listeners, normally the thought of the day is a quote. In evaluating and researching Dr. Roseann, I could not just pick this quote, because everything that you do just took me to this story that I wrote for my students back when COVID first hit. And I was like, this just makes sense to me. And this is what I see in you. So this is really, I know we haven't met, but I have researched you, and this is just an honor to you. So here it goes. So I have always been drawn to the peacefulness of water, specifically the beach. I believe there is something in all of us that finds home in that space. Maybe it is because the first 9 months of our lives, we were spent playing in the water of our mother's uterus. Either way, listening, touching, tasting, smelling, and seeing the beautiful ocean grounds me, takes me home, and makes me feel safe. With all the uncertainty of COVID-19 and the implications its presence has on our lives, leads me to think of a great ship destined for high seas. Clarissa Pinkola Estes has a very fitting quote that perhaps can make us make sense of this unique time in our lives. And the quote is this: when a great ship is in harbor and moored, it is safe, there can be no doubt. But that is not what great ships are built for. It is in these times where we are forced to dock our ship that we must find a way back to sea. We too were built for a specific purpose, and we find our buoyancy in love, hope, trust, connection, and empathy. The tide might be low at this time, but it will rise, and will rise to lift all boats safely back to sea. It is during this low tide period that we must reach out to each other, like a boat lost at sea who uses the lighthouse as a guide to safely arrive home. Be the light for yourself, for your family, for your friends, for your classmates, your neighbors, and anyone else who might be lost at sea. It is during these times that each of our individual lights can join together to shine so bright that we can safely guide the most distant boat home. I know that was long.
Yeah, there's a lot to take away from that, but one of my favorite sayings that my friends and I, who are really, we all are these mission-driven leaders, and we're all trying to change health in one way, shape, or form or another. So we always say rising tide lifts all boats. And when you work together, I got the goosebumpies on that. When you work together, you can make so much happen. And I think in a time, you wrote that like, in the beginning of the pandemic, because isolation has sunk into people. And I have never seen more agitated and distressed people than I have right now than in my 30 years. And I think that we are not doing enough to reconnect, right? And you also just talked about some really powerful words, hope, belief, trust, safety, empathy, right? These are things we don't focus on enough. And instead we focus on some kind of fix for things. Like you said, you have to work at your marriage. I'm also going to tell you, Jeff, you're not doing a good job, because that means you're also not saying, yes, honey, whatever you want sounds good to me. Because that's what all good husbands do.
Oh, my wife. Yeah, no,
I'm kidding, but I'm not. Mike's cracking up. That's what my husband says all the time. That's wonderful.
What is she doing to us? Our wives listen to us. What are you doing to us, Dr. Roseann?
Yeah, my husband always says, did you buy the most expensive one? You deserve it. I hope that you bought the most expensive one, right? He does it all the time, right? So he's just really easy and funny. He's like you guys. And but life is work. There are things that are work. Like, we have parenting issues. Our kids come out the way they come out, and sometimes they're pains. Sometimes they're difficult. Sometimes they challenge us. Sometimes they remind us of my jerky brother. I'm not saying that's the truth, but there's things that happen in just like in marriages. Like, I'm married almost 26 years, absolutely, truly very lucky. And, but when struggles happen, we freaking get to the mat. We work through it. We don't say, forget about it. And I think people don't realize that in relationships, that friendships, whatever, you can have conflict and get through it. You don't have to throw in the towel. But when I heard you say those words about, I feel like hope and belief and trust, it is so hurting for people. Like, people aren't believing in themselves. They are losing hope. I deal with parents every day who are out of hope. Right. So I have my coffee cup says it's going to be okay. That's the title of my book. That is literally the first thing I say to parents who work with me. And why? Because they need it. They need a hug. I miss my hugs, right? I mean, I'm starting to hug people again. I don't really care. And, but it's scary when something is going wrong for me with a kid. And I mean a kid at any age. You could be 30 years old and it's still your kid. And I just think that that's what we need to recalibrate and focus on. And it's got to be something, these are all lessons that start within ourselves. Right. And it's so important for adults to do this work for themselves so that they can be better human beings, be more connected to the powers above, to be more grounded to the floor below, and then show that for their kids, be that for their kids. And it's so easy to get caught up in a worry loop. I always say it's like, when you're struggling or your kid's struggling, it's like you get on the worry train and you're like, I've said before, I've been driving the worry train before. And then I'm like, I'm getting off. This is my stop. And it really starts with hope and belief and trust.
Man, you said so much, and we're definitely going to get into this self-care and yeah, I think I want to take a step back, of you talking about that you're seeing so much anxiety and just kind of distress right now. And I'm going to share something, but I want to take a step back and just let some of the listeners know, especially the local ones in the Northern California area, our nonprofit is geared to just get people back to hoping and believing and trusting and using, I know you're Italian, using pizza as a way to be a conduit to help people see each other and get comfortable and be able to reach out and hold hands and get the oxytocin kind of cracking, and get us having some endorphins that allow our cortisol level to drop and to just see each other. But the need for that is just off the chart. And I told you,
off the chart.
Yeah, I've been a nurse for 29 years, and I worked a good chunk of it as a college nurse at Sacramento City College. And every year there's the American College Health Association does a study over 150 institutions in the United States, 2 and 4 year institutions. And I'm out of that space now. So these numbers are from 2019, spring of 2019. I doubt they even did it in 2020 and everything with the pandemic. But I'm just going to share a few of them. And these aren't great numbers. I mean, it's the end of 67,000 students. So, I mean, that's legitimate. But to put these numbers in context, it was, have you felt this in the last academic year? So, and here's the numbers. So 71% felt very sad. They didn't exactly quantify what that meant, but 45% felt so depressed that it was difficult to function. 66% felt very lonely. And again, these were before the pandemic. 56% things were hopeless. We just talked about that word hope. So we got 56%. Again, not to put Mike and I as being these old guys, but man, college was a difficult time, but it was also the time of your life.
Holy moly, I stayed for 9 years. It was awesome.
Exactly. And that time is just not the same now. And now we're looking at 56% felt things were hopeless. And again, these are college and university students.
Yeah. And this wasn't just that university, because that at that time in 2019 and 2020, there were lots of research studies showing that the predominant feeling was feeling isolated.
Yeah.
Pre-pandemic.
Yeah.
And so there's a lot behind that too, Jeff, because I can tell you, when everybody asks me, you've been working with kids for 30 years. And again, I mean, young adults and down. I can tell you that there's some clear things that are happening: no stress tolerance, and a rise in anxiety, of course, a dramatic rise in autism, but really a lack of social skills. Like, social interactions are not the same. And there is a definite impact later when they're independent in college, right? Remember being in college? You could go anywhere and make a friend in college.
Yeah.
Not the same.
Yeah. I mean, you're staying, I want to get through that. I got like 3 or 4 more of these, because it's just I think this is.
It's startling. Yeah.
No, it's incredible. 87.4% reported feeling overwhelmed by all they had to do. 85% felt exhausted, not from physical activity. 65.7% felt overwhelming anxiety, and 43.3% felt overwhelming anger. And again, this is legitimate. This is numbers from American College Health Association. It's a study that's been done for years. 67,972 college and university students. So these numbers are legit. They are true. This is how the students were feeling before what was going on. And then I think, for me, Dr. Roseann, I see these. One, my heart just hurts, and knowing that this represents how our young people are walking around, and that we just have to do more to help slow life down. But then you look at back to your role, my role, Mike's role as a parent, knowing that these numbers are probably not too far off for the likes of us, and then you start looking at, okay, 87% reported feeling overwhelmed by all they had to do. Okay, well, there's a mom and a dad. Again, these numbers aren't from any study, so I'm just relating them to it. Exhausted, 85% felt exhausted, 66 overwhelming anxiety. So now you look at your job as a parent and your kids giving you the business, and I'm just too tired. I'm too stressed. And I have some anxiety myself. And that's probably why your business is booming. You're doing some amazing work to help your families and the children and the young adults. And so where the heck do we start? You know, I'm just gonna give you right there.
Yeah. I mean, everyone always is like, how did we get here? You know what I mean? And I don't think there's definitely not one answer, right? So I think we have to look at, like, this is multifactorial. There's multiple things all sort of converging and creating this perfect storm. And then we have the pandemic. And, you know, some people are experiencing mental health, you know, anxiety, stress, depression, suicidal ideation, first time in their lives. But, you know, we do have some research from through the pandemic. And we do know that through Stress in America survey by the APA, comes out every year, that 70% of parents are reporting significant stress due to pandemic parenting. No surprise. And there's a lot of other research to show there's increased anxiety and depression amongst teens and young adults, which is that college age there. But, you know, what is happening? What's our societal basis for this? So number one, we've accepted a stress lifestyle, a high stress lifestyle, right? And so we are running around on empty, we're sleep deprived, we don't have good food quality in America, right? Out of all the westernized countries, we have some of the worst food quality, right? Europe doesn't allow many of the preservatives and chemicals that we put in our food because, hello, it's bad for your brain and body. You know, what does this matter? It feeds physical issues, which then result in mental health issues. And we are not a connected culture, right? So there are pockets in the United States where people live in communities that are more connected, which is why I think it's so awesome that you are doing community events to get people connected. We are social beings. And when we are antisocial, our mental health suffers. And that is exactly what happened in this pandemic. We went in on shaky ground, right? And guess what? There is a lot more to come. We don't know the long-term impact, but what we do know through other types of research about the long-term impact about significant mental health issues like trauma events is that what you bring to the table is how you get through it. So if you had certain protective factors, like one of the best protective factors of mental health is social connection. So you are socially connected in your community, a church, family members, friends, you're going to automatically have less of a chance of mental health issues, right? You have good coping skills. So I talked about stress tolerance just going out the window. What does that mean? That means kids today don't know how to cope with stress. And we have a style of parenting, you want to call it helicopter or lawnmower, I call it bubble wrap parenting. And we are not letting our kids make mistakes, feel uncomfortable, and learn how to regulate their emotions when they're uncomfortable. So when something little happens or big, they fall apart. And so you have a lot of very anxious teenagers and college kids, right? And the kids are really pushing themselves. We have totally developmentally inappropriate expectations about schoolwork. We're pushing every kid to be a straight A student and go to college. Like that is the only answer in life. That's just silly, right? I was not a straight A student. Let me tell you, I don't even think I was a B student. And hello, I think I did okay. So, but it's a different time and I have to honor that, right? We have a lot of disconnection by too much technology time. I'm a big fan of technology. I love it. It's transformed my life, but you have to have, it's what are you missing when you're on for 7.22 hours a day as a 13 to 12 to 18-year-old. 7.22 hours a day. That's the average pre-pandemic.
Yeah, I got to interrupt you because I think we're all smoking crack. I think that number is so much higher.
Oh, absolutely.
No, because I'm fast. That's one of the areas that I'm a fan of technology as well. It's not going anywhere. I'm not trying to be ignorant that way. It's incredible what it can do, especially for people that we push to the margins in our country, specifically people with disabilities. It might look a little different, and people aren't going to give them a time of day when it's face to face because they look different, which is, again, our societal problem. But it's a game changer for them because online they're normal, whatever the heck normal is. They can connect. But yeah, I still think that number is so low. And I think I'm always fascinated, but a lot of stuff that I've read is people will be on their phone, on their computer, and they'll have 3 or 4 devices going all at the same time. And I do think our brain is working, obviously, to be processing all that. And so no wonder why our attention span is less than 7 seconds. But you said so much that I got to try and unpack a couple of things. And I want to give a plug out first to Vivek Murthy, who wrote the book Together. And he was our 19th Surgeon General. And I just read that book a couple months ago. Would highly recommend it because we're talking about relationships. We're talking about connection. We're talking about helping people learn how to cope. And you do that by your tribe, your team, your family, your community. And in his book, he gives some great ideas for that. But then he also gives the research on when we don't have that connection and how loneliness is probably the worst disease process that is out there that doesn't get any sort of mention. And we just kind of let our brothers and sisters, what I would say, sometimes my wife gets a little fired up that I use those terms, but I do look at everybody in this world as a brother and sister. And we just let them stay in their space of being lonely. And there's so much research that is worse. That loneliness is worse than smoking 15 cigarettes a day for 15 years, worse than being overweight, worse than type 2 diabetes, as far as the impact on your health.
Yeah.
And yeah, there's just so much. I start to get a little bit riled up and so much that we can do to help each other if we can just slow life down. So I just want to ask you real quick on nutrition, and maybe we just try and give some tips to parents or some young listeners. If you were just to pick one tip nutritionally right now, what would it be to help someone enhance their life through nutrition?
Yeah. Well, I dive all into this in my book. It's going to be okay. But I mean, in terms of a diet, I'm going to say a diet and then I'm going to give you a tip. I believe in an anti-inflammatory diet. So this is what the research. So everything I do, I'm a research nerd. I got 40 pages of research citations in my book. What I say, I'm basing it on doing research because we have to let people know, research is important and we have to think about everything. How does it affect the brain? And so nutrition, what you put in your mouth affects how your brain and body works, people. So I would say one of the biggest things that people are doing wrong is they're not eating enough healthy fats. And we need healthy fats for the neurotransmitters to work. We need healthy fat for our gut to have proper bacteria and for that electrical activity in the gut to occur, because the brain and the gut have just about equal amounts of electrical activity. And that's surprising to people. And then two of them are connected by a bidirectional pathway. And so healthy fats, as we've had a low fat diet, we've had a 1,670% increase in anxiety and depression with a push towards low fat diets. So we need more fat. Now, it's not as simple as just adding fat if you're still eating a lot of crap. But when you have things like avocado, nuts, coconut, salmon, eggs, hummus, these are great examples of healthy fats, and our brain needs it to work properly. And you will feel less anxious, according to research. You will feel less depressed. You will be more focused. So it's so important for kids and teenagers for developing brains.
I love that. And yeah, you always feel better when you eat better. And then I'll just say for me personally, when I'm eating better, and I say, man, I'm eating better, let me go on a few more walks. Let me stretch a little more. So it just kind of goes hand in hand.
Get your energy, your vitality up. Like, you know, it breaks my heart to hear that many young people are that fatigued all the time. I know this to be true because I get all these kids, you know, coming into me reporting that, and it's from chronic stress. It's from that hyper stress activated nervous system. It's like a stressful event happens. What do you feel after? You don't feel energized. You feel exhausted. So that's what's happening to our youth. I mean, at a time in your teens and 20s and you're exhausted most of the time, what is that about?
Yeah.
You know,
you said so much other stuff early on, and I wanted to mention, you know, not to get in, we're not going to fix the educational system in the show, but I do think that'd be one tip that I would love you to have some insight. And I'm sure you're aware of Finland being an incredible country with their educational system. And from other stuff that I read forever ago, their first few years in school, kids don't learn
play-based
anything
till age 7,
academic stuff till they're 7 years old.
Yeah.
And they just learn how to play and make that fun.
And guess what? A cold country is always in the top 3 mentally healthiest, happy countries. Why do you think that is? Because they know how to get along and they know how to connect.
Yeah. It's just, I just think we've gotten things twisted in our country by trying to have our kids learn too early. I'm not saying, hey, don't challenge, but that just the time has to be right. You know,
well, we in our country think grades are a benchmark of mental health. So they think that if my kid's an A student, they can't be anxious, depressed, or suicidal. And I'm here to tell you that's a big no. That is not true. And it's hard because we're all putting pressure on each other with, you know, fake book and all these social mediums to look a certain way. Oh, my kid got into this school. My kid got into that. They're not telling you that 40% of colleges, the kids leave, right? They transfer out or they fail, right? That's an average, right? Does it mean they never go back to school? No. But, you know, we're pushing kids towards, you must go to these schools. You must take on tremendous debt. And for what? You know, I always say, Mr. Hodge and we went to state school and we did okay. You know what I mean? So I just, it doesn't make a lot of sense. In my dream, I say this all the time, my dream, I would love for all kids in America to be required to do a year of postgraduate service at a place of choice, like whatever, Salvation Army, Peace Corps, the military, something. And the government paid you for your year of service. And then we would take the focus off of the school, and kids would then be like, where's your year of service? You know, and then it would give them a chance to do college applications, do these other things in a way that allows kids to have some developmental growth, you know? So that's just my suggestion. I don't think it's going to happen anytime soon, but we do see more and more families who can afford it, letting their kids do a gap year, including Barack Obama did that with his kids. So, you know, I think that's pretty cool. You know, there's just a tremendous amount of pressure on these kids. And then they get to college and parents are like, here, I duct taped you up. You got your straight A's. You're so anxious. You vomit when you talk to a girl. True story. But you're going to go to college because you're straight A. And here you go. Let me drop you off and your mental health will automatically be corrected. And I just don't think, I mean, we have such a misbelief about what mental health, what it looks like. We think you're not functional. That's not true. I mean, 1 in 6 American adults are on a psych med pre-pandemic. You know, most people with mental health issues are walking around. There's an area in their life that it's showing up, but it isn't a full breakdown across everywhere. So they're missing these kids. They're not understanding that you can get these grades and be just a hot mess inside.
Dr. Roseann, I got a question for you. I'm a
Sure.
basketball coach. I coach high school here locally in San Pedro. And I recognize kids have all these pressures from all over, and they have a hard time just being present in the moment. And when I coach basketball, we find that we keep going over the same things over and over again. And I'm not just talking about days, sometimes for years, and the kids just can't grasp it. Is there something as a coach that I can do or I'm missing to help these kids? Because it's basketball, it's a game, it's supposed to be fun. So we're trying not to put crazy amount of pressure on them, but at the same time, we're trying to get them to communicate, to be together, to create that community, the family within the team. Is there anything I should be aware of or that can help me with that?
Yeah, I have lots to say on this, Mike. So first of all, I just want to say that we absolutely have more issues with kids. So there is an increase in anxiety, depression, ADHD, all the clinical disorders. 10-year-old research says that 1 in 2 kids in America have a physical or a mental health problem. So that's 10-year-old research. I can't even imagine what it is now. So we are just, they say in about 25 years, 1 in 4 children will have autism. Mm. Our country will break financially. We will not be able to educate and maintain the lives of that many kids with autism. We have to back it up. So let's just talk about focus. Let's just talk about what's happening. So first of all, we're over-parenting our kids. This is now what's showing up on your coaching door, Mike. So these kids are not, we're not cultivating independent decision-making. We're not cultivating attention and executive functioning in our kids. Instead, we're bubble wrapping them, right? And we're not allowing them to have failures. And when you fail, you learn, you problem solve, you do it, you prevent it, right? Maybe you have to learn, maybe you have to make that mistake 10 times, but you figure it out. But instead, we have parents intervening. So when kids are showing up with you, they've been bubble wrapped. The parents say, let me take off the bubble wrap. Let me give them to Coach Mike. And they don't know how to pick up the implicit cues around you. They're not. So the first thing you have to do, because everyone else is doing this, but you're going to do it differently. Everybody is like working with these kids, the parents, the teachers, and they're like, you have to have a checklist. And let's start with our checklist. Well, these kids don't even understand what the checklist is for. So you have to reverse engineer it for these kids. You have to start with your end result and work backwards. And I'll explain what that looks like in your situation, because these kids' brains need to be rewired. If we're constantly reminding them, what's going to happen is their brain is not going to get it. You're going to just have to constantly, you become the scaffold for them, so they don't need to do it. And in every area of their life, they're scaffolded. So why would it be any different where you are? And so I think you need to have a really great conversation with your kids and be like, listen, you're going to be thinking for yourself, and this is what it looks like. Okay. And I think you also, as a coach, say, we get their stressors. We get kids don't always get along. We get you have a lot of academics, but this is what this is, and this is what we're going to do. We expect you to do this, this, and this. Super, super clear, big picture items, whether that's have fun, play in every game, whatever your expectations are, you have to make the implicit explicit. I'm not saying handhold them. We're just being really clear. But when you're presenting a concept for them, like, I need you to do this, and I am not a sports person. So whatever it is, you have to say, this is what the outcome is. Then you work back. Instead of saying you dribble and then you go to this, you say, no, I need you to make this ball in. Let me reverse show you how to do it. And you change that language, because they're so stuck in the dribble, they don't understand where it's going. And it's because we're constantly leading our kids without really letting them develop. And that's what's showing up on your doorstep. You know, when we were kids, it was like, we went and did that. We figured it out. You didn't have to explain everything. You just got it. But we're in a situation where we're like micromanaging the learning in our kids, and it's showing up in every facet of their life. Does that make sense?
Yeah, that makes a lot of sense, actually. Absolutely.
Yeah.
Wow, thank you.
Yeah. I mean, their brain is ill prepared. And that's why so many kids flunk out of college. That's a dirty little secret in college, that these kids are like straight A students, but they're not, because they have tutors. They have their parents helping them. They have an IEP. They have a 504. Then they go to college, and you're not in class the bulk of time. You have to be independent problem solvers. And if I had $1 for every parent who was like, well, he's got 126 IQ, and I'm like, but he can't flush the toilet. This doesn't really help him. Yeah, you got a good point, Roseann. Yeah. And I'm like, let's get it done. Let's work on the nervous system. Let's develop executive functioning. It's really about executive functioning. The attention is one facet. Are you present and engaged? But where is the problem solving? Where is the long-term thinking? That's where your, you know, I don't want to say your students, but the athletes you're working with, they're literally like, as my sister who's a teacher is like, I get these kids, they got 130 IQ. It's like they got their finger in their nose and they're just waiting for me to say, do this, do this, do this. They're not like, oh, Mrs. Smith, you want me to make this. I get it. I was thinking about this. How does that sound? No, they're literally like, okay, what do I do next? What do I do next? What do I do next? And it's not getting ingrained. They're not being hardwired to be problem solving thinkers.
Well, that's the challenge, you know, where I get riled up with technology, because we're creating pathways for them of just, hey, go ahead, find you have a question, but you're not really interested in the process of coming up with the answer. You just want the answer then to move on, which kind of goes back to Mike's challenge of why it's difficult for his athletes to be able to take a concept, work through the process, and then get to the end. And where I love hearing how you're saying, hey, just like Covey, begin with the end in mind.
Begin with the end in mind.
Yep. And here's the outcome that we're going to achieve, and then here's how we're going to get there. And I love that tip, because that's a great one and a practical one that I think we need to do a better job. And what about, just to finish up this question that Mike had for you, would it be helpful for him to even start his practices, which you're going to think, oh, Jeff, you're losing it, but make sure his athletes aren't on their phone, because it takes a good 15, 20 minutes to get their thoughts to come back, you know, and I guarantee they're walking into the gym on their phone. But start practice with just some mindfulness breathing to get their amygdala kind of not firing so much, get their parasympathetic system kind of slowing things down, and then put them in the best possible position, and maybe take that 7-second attention span and bump it up to 8 or 9 seconds, because their brain is not elsewhere.
Absolutely. You have to power down to power up. Okay. So the problem is we're in this, you know, our autonomic nervous system, as you talked about, like here's brainy nerdy stuff with Dr. Rowe. When our autonomic nervous system regulates everything and regulates our stress response. So when we are constantly in a rev state, we're in a sympathetic dominant. When we're in a relaxed state, we're in a parasympathetic. When you're in a sympathetic dominant, and you're in this stress state, and I know most people, parents, you know, adults listening are thinking, well, what is my kid stressed about? It's everything in the environment. It could be the other kids. It could be the workload. It could be noise. We're moving. It's an activation of being on technology all the time, right? So when we're here in this state, physiologically, our brain is designed for our frontal lobes to go offline. So we are not able to process language in the same way. We are not able to take action in the same way. So to start off with a mindfulness-based activity like breath work, This is amazing stuff for them. And we know through research, okay, 40 days of meditation, 10 minutes or more, improves anxiety, depression, and focus after 40 days. Like, it's a no-brainer. It's free, people. Just got to do it. So I think it's a great strategy. And I think kids are walking through the door. It doesn't matter what income you are, what race you are, what gender you are. We are confronted with stressors every day. And if we are not giving our kids really concrete tools, just deal with it. What does that help them? We have to teach them these things. I mean, I think, I've been saying right from day one of the pandemic, they better go back to school next year when these kids are back in school the next school year in a few weeks. They better do 15 to 20 minutes a day of mindfulness activities in every school in America. It is the fight. If people want to think about the financial components, right? The financial ramifications of the poor mental health of our kids and teachers too, who are battle weary. This is big money. This is long-term ramifications. So let's say, how about a federal government mandate with training, 20-minute period every day in America of meditation, breath work, yoga, whatever, I don't care. So one of them, 3 of them all got research behind it. So
I love that. And I want to get into your expertise, but this is why this could be like a 6-hour podcast to me, because I'm just fascinated with what you do. But yeah, that's the challenge in education. Historically, there's 1 in 6 teachers that are normally thinking about leaving the profession. Harvard Business Review just put out a new study that number is now 1 in 3. And
I'm not surprised.
A nursing professor these past few years, that job was always difficult, and then the pandemic came and it became so much harder. And so I'm working with adults who have their prefrontal cortex firing and are able to get to that executive center and make some logical choices if
they're not stress hyperactivated. This doesn't matter if you're an adult or kid. If your nervous system is stress hyperactivated, your frontal lobes go offline too.
Yeah. But I'm talking about kids who don't have that ability yet.
Yeah.
Who are always offline I just love your suggestion of, hey, we need to get in and just do some breath work. And I've never heard that you have to power down to power up. Hopefully we can do that for the teachers and not give them more and more work to do, but allow them to slow things down. And I think I sure hope our country can use this pandemic to say, you know what? We've been broken in so many different parts, and a lot of people get upset with me when I use that word, but I love that word, especially from the medical standpoint, because when you're broken, it means you can heal. And most of the time, when you heal, you're stronger in the places where you were broke. But I'm talking too much in this thing because I really want to.
No, and I also have to say, I love that you use the word heal in mental health. When you're licensed, nobody ever wants to say the word heal. I say heal, reverse, statistically improve. We need to let people know these things are possible, and it starts from within. So we're always giving away that power. And just because you are stuck, you're having a hard time, you just have to do one little thing to open up and start moving in that direction, and just know it's going to take some effort and it takes some consistency. But when you do it, it's powerful. It really can be pretty transformative, and instead people give up because they just don't know any better. That's why I talk about the science about, 40 days, I could do 10 minutes, 40 days. Okay, document it on a scale of 0 to 5. How anxious are you? Show some data to yourself. Do the work, and there will be a positive payoff. There's nobody that's not going to do 40 days of breath work that's not going to have a positive impact. Is it going to bring it to 0? Maybe not, but maybe it brings it from a 5 to a 4.
It's definitely going to help. And I want to get into transformative. I love that word. And now I just got to be quiet. I've been taking so many notes. So let's get into, and you figure out where you want to start, your neurofeedback, your biofeedback. Yeah. So any parents that are listening out there who have just been, dealing with these challenges with their kids, going to the doctor, getting prescribed medication. Again, not that I'm not going to get on that. I don't want to go down, but let's just get into your expertise, this neurofeedback and biofeedback. I'm going to be quiet.
Yeah. Well, first of all, I'm all about solutions for struggling kids and families. And that is my Miss America platform, right? And I want people to know that there are. That's why I've done all this darn media, and it's hit billions of people. And I want you to hear this and see this as a possibility. Like, I want you to hold that vision. And here's my statement about medication. 100% of the time, medication should never be the first line of defense in a developing brain. Okay. So if it is the first thing that is offered, it's a hard no, people. Okay. There is not enough research to show the efficacy of psychiatric medications with children. 70% of the time, we are using psychiatric medications with kids under age 18 off label. That means no research to substantiate their efficacy. So I am a scientist. I am a research person. We have to go to the research. Okay. So know that. Okay. And know that there is my patented process. What my method is, grounded in lots of research. We know that if the nervous system is stress hyperactivated, you cannot, as I talked about, think, take action. Okay. So I regulate the nervous system. I come in with new learning. New learning is either psychotherapy or coaching. Okay. It works, people. It's grounded in science. You can't just regulate the nervous system of a kid who's got ADD and then think they're going to know what to do when they're for 12 years been totally not paying attention. You have to teach them what to do. Just like what I talked about, Mike, when I talked about coaching with the end result and then working backwards, right? It's based in science of how the brain works with somebody with good executive functioning, right? With somebody with good executive functioning doesn't walk into a grocery store and say, what am I making to eat? Like, I already have my dishes out in my head. And then I even make a grocery list based on the aisles. Okay. So I go backwards. I don't start with that, right? You don't just like throw stuff in your cart and it's like, oh, I got some steak and potatoes. I guess I'm making steak and potatoes, right? So we have to retrain and do that. So I have a big toolkit. And so my toolkit of what I do when people work with me in person in Ridgefield, Connecticut. People still fly in. I got somebody flying in from France. But I also work remotely with people all over the world and I send them equipment. And it's pretty cool. So I have clients in Saudi Arabia and Asia and all over. And why do I do that? There are certified neurofeedback providers all over the world, and there's some great ones, but it's a mix of an art and a science. And I've been doing this for a long time and I'm awesome at it. And so that's what people come to me for. And it's more than just neurofeedback. I'm truly integrative. I do nutrition. I do all that stuff. So neurofeedback is a tool I use, biofeedback, PMF, and very specific types of coaching methodologies and psychotherapy. So we do ERP, which is a type of therapy for OCD. We do somatic experiencing, which is a bottoms up type of therapy approach where you teach people to connect to their body, which is a major problem in kids and adults. You go offline and you come in and you try to do talk therapy and your brain just can't process it. You have to reconnect at the roots and then work up, right? Kind of common sense. We do EFT tapping. We do executive functioning coaching. That's one of our big things. So let's start with my baby neurofeedback. So I love neurofeedback. I say all the time, I'll say what it is, but it takes a dysregulated brain and makes it regulated. How does dysregulation show up? It shows up as mental health issues. It shows up as attention problems. It shows up as impulse control. It shows up as being cranky and moody. It shows up as being anxious. And so it's so easy with this bombardment of stimuli in our life for our nervous systems to get overstimulated or understimulated. And so when I work with people in person, I do something called a Qeg Brain Map. I'll say what that is. And then when they're remote, I do what's called a brain check. And basically both are ways for me to see visually what is exactly happening in the brain. Certain regions are overworking or underworking. When I do a Qeg, I not only can see specific structures, I actually can see the neural connections between the sites. And that shows me how people are processing. So for example, really easy to understand when people come in and they're like, my kid's ADD. One, we can validate that. We can say, you have too many unfocused brain waves, not enough focused brain waves. It's actually ridiculously easy, but half the time people come to me and say, I have ADD. It's not. Could be a processing problem in a different region of the brain with sequencing. It could be anxiety. It could be depression. Many things make your attention go offline besides ADD. So it gives us a clear print. You clearly know diagnostically what's going on, and then you can do the right treatment at the right time. So most people come to me because they've had multiple treatment failures. Some come to me because they right out of the gate were like, I heard you're awesome, and I only want to do evidence-based natural things. And I'm like, well, I'm your girl, right? But most people come to me because they're broken. They're out of hope. They're trying to avoid a psych hospital. They've gone to 12 therapists. My world record is I was the 55th person as somebody had seen. It's not unusual for people to see 20 or more providers before they get to me. And this could be a 12 or 13-year-old, it's kind of insane. So everything I do is informed in science. So what is neurofeedback? Essentially, like I said, it takes you from a dysregulated state to a regulated state. Well, how do you do it? It's done through use of computers, very safe, 50 years old, tens of thousands of research studies, 3,000 peer-reviewed studies, so higher caliber. And a person is hooked to a computer. Their subconscious in 2 to 3 seconds says, oh, if I push down this brainwave and increase this brainwave, I get this visual and auditory reinforcement. And boy, do I want that. So in 2 to 3 seconds, it goes from a dysregulated state to a regulated state in 2 to 3 seconds. It's not going to stay in a regulated state unless we work out and we do 2 or 3 sessions a week over a number of weeks or months. Most people are doing 40 sessions because it's building a muscle. And the reinforcement, typically most providers are using what I use, movies. So the movies won't play, you won't get secondary auditory, and there's other visual reinforcement. And literally the subconscious brain, it's like jumping on a treadmill. You just jump on a treadmill and you start running and you do it and you do it great. That's exactly what happens in neurofeedback. It's pretty amazing. And it's so safe. There's never in these 50 years been any research to show that even if you had a temporary side effect, like you felt tired, a headache, those would be your most common. They're temporary and they're not lasting, and you make an adjustment of where your placement is. So it requires, the number one determining factor in neurofeedback is the experience of the person in designing the protocols. So you really have to be really experienced to know. And that's where I do a lot of complex cases. I do a lot of straight ADD too. ADD, when I get somebody with just ADD, I'm like, it's just ADD. Usually it's like ADD, anxiety, depression, a learning disability, some eczema, gut issues, So that's that's literally, I can do that as young as 3.5. I can do it all the way into somebody's in their 80s. I specialize in young adults and kids all the way down to babies. And that's probably the most common thing that I do, but then I do PMF. And the quickest way for me to say what PMF is, it's a technology that's based on frequency theory. It sends a frequency to a cell, changes how the cells work, automatically takes you from a stress state to that relaxed parasympathetic, and then it improves detoxification in the body, which lowers inflammation. So there's a triple hit, and it works on that body level. It's something I use. I do a lot of infectious disease, and I do a lot of autism. And whenever anybody is agitated, like really agitated, that is one of my go-to resources. And then biofeedback is conscious control. So teaching somebody to conscientiously sync their breath with their heart rate, or warm their body temperature, change their muscles. Why would I do that? Typically stress and pain would be the two most common reasons I do that. And we do that, and that can be done. I started doing biofeedback when my little guy was maybe 2.5. He had totally extraordinary attention, but you only have to have 2 minutes of it to start really even seeing a difference. It's really pretty powerful.
Wow, man, a whole bunch of amazing work.
So those are all my nerdy brain treatments that I get to help people with every day.
Yeah, no, it's just incredible. And I love, just from being a nurse, everything in nursing is always evidence-based, always trying to research and stay on top of what is proven to work. And I love that's a space in which you operate. I really love how, and I hope the listeners are listening, and let me get back. I've been writing so much notes, but roughly, how you said, hey, if 100% of the time, if they're trying to introduce medications right out of the gate, that's not going to be the answer that you're looking for. And
you're giving up your power when you're doing that. You're saying that there's nothing you can do besides that. And I promise you, when you rewire the nervous system through behavior, you're going to get the outcome is going to be very different. And, we have to change that expectation that it's an overnight process, because parents just don't know. That's the problem. We're telling parents this, right? Like, good marketing from pharma is telling us that a pill is going to fix it. And then parents are constantly disappointed and out of hope. And parents often are like, why didn't I know about this? And I'm like, because it's just not the predominant way that things are done. Like, my field has turned into, after a couple sessions of therapy, you don't feel like you can get anywhere. You send them to a psychiatrist. Well, what are you doing? When that happened to me, I said, I got to go to research and find something else, because it's not a one size fits all. And I'm not against talk therapy, but what we know is if frontal lobes are offline, the talk therapy is ineffective. You get the brain online, you do the talk therapy. That's how it works, people. You don't do the talk therapy to get the brain online. It's the opposite, is what science says, So we have to look at that.
Yeah, no, that
and work for that.
Yeah, it just makes so much sense, the way that you're describing everything. Educate Mike and I and the listeners, because I was not obviously aware of OCD, obsessive compulsive disorder, but was not aware of PANDS, Pediatric Acute Onset Neuropsychiatric Syndrome. And then what's the other one?
Oh, Autoimmune Encephalopathy.
Yeah, that was...
Yeah. You said it. You said it without messing it up, Jeff. That was great. So let me talk about PANDAS and autoimmune encephalopathy. We call it AE, and why everybody should know about it. So number one, it's dramatically on the rise. About 1 out of every 150 to 200 kids in the US are diagnosed with it. Okay. And it used to be pediatric onset, which was the P stood for P. We now are allowing adult onset. So it's when you have an infectious disease or a toxic trigger. So it can be anything. The most common ones are Lyme, tick-borne infections, Lyme, Bartonella, Babesia, ehrlichiosis, and things like mold, COVID, the flu, mycoplasma pneumonia, and strep would probably be, these are the most common triggers. And what it does, creates a misdirected immune response. The body starts attacking itself, massive inflammation in the brain results, which then triggers the psychiatric issues, anything from rage, OCD, tic disorders, involuntary motor tics, to loss of skills, like loss of handwriting, frequent urination, separation anxiety, depression. These kids are misdiagnosed. These kids are diagnosed as ODD, bipolar. I was on with a therapist today, and the kid had a history of anxiety, and then he had COVID, then he got diabetes, then he got psychiatric. Now they're saying he's bipolar. And I said, do you not see this is PANDS? She was like, oh my gosh, you're totally right. And I was like, yes. So he's also got OCD. So, so it's there. And, the thing is that you can have a pre-existing condition, but there has to be a big spike, or you can have no condition and then it's sudden onset. Autoimmune encephalopathy, same symptoms, no sudden onset. So there can be we call a soft signs can be there. It could be like a series of ear infections, some anxiety, a little this, and then these symptoms can wax and wane and go up and down. So they get caught in the cycle in the mental health world, and practitioners know very little about it on both the mental health side and the medical. And it's not unusual for me to have somebody who's been a decade searching for an answer, and it's a toxic trigger most of the time. I mean, infectious disease, so it's treatable. But once these things like, tick-borne disease, you have it very much in California. Once tick-borne disease gets in, as little as 2 weeks after a tick bite, you can have late stage Lyme. And so that means it gets deeply into these organs. And so it's a nightmare, and it's really hard to treat and expensive. And it's hard because you just can't get good care. Pretty much every day somebody sends me a message like that's a colleague. And yesterday I got a colleague from my friend, and she's an acupuncturist, and they live in New York City. And she said, my daughter went to beach area, and we saw an article in a major publication in the last couple months come out that says that ticks are in beach grass at very high infestation levels. And so she got bullseyes, and they gave her 10 days. So she's like, I know I've heard you on a podcast saying it has to be 30 days. And I said, yes, because a spirochete takes 28 days to cycle. So 10 days isn't going to kill it. So why am I, Dr. Roseann, the psychologist, saying this to her? And, the MD should know this, but they don't. We are just operating on a lot of terrible information that is contrary to research. So, and that's why we have these dramatic rises in people having these mental health issues as a result of infectious disease, because ultimately we have a lot of ignorance about infectious disease and how it should be treated.
Mm-hmm. Man, deep.
Kind of scary, right?
No, definitely scary, especially now.
Yeah.
The pandemic, kind of sort of not really allowing people to get out,
Yeah.
And, that's why your knowledge and your generosity with coming on shows and getting the word out is so appreciated. We're almost ready to wrap this up, but I want to go. I'm still taken back by your comment earlier of roughly, 25 years from now, 1 in 4 children, I think you were saying. I haven't heard any of those things, but I would love for you just just explain, or do you even know?
Autism. There's so much misinformation about autism too. I mean, it's so dramatically, it's 1 in 37 births now. So, 1 in every classroom and a half, less than, classroom and a quarter has a child with autism in it, right? And it's autism spectrum disorder. The majority of people are what's called mid-functioning. So they're cognitively around borderline or cognitively disabled on the high end. So they can look very typical, right? Kids with autism can look like they're not a child with Down syndrome. They don't appear on the surface. Sometimes there's a larger head circumference. But when a kid is cognitively lower, it's easier to catch them because they miss their milestones, right? But we also have a group of kids that are referred to as high functioning, but it's only because their IQ is higher. But they all have these dramatic social impairments. So the same reason we have a rise in mental health issues in general are the same reasons why we've developed neurodevelopmental disorders. So it used to be older mothers only were having kids on the spectrum, right? So once you're age 36, you have a 400% increase in having a child at autism at age 36. That is not the only reason people have kids on the spectrum. You have young mothers having kids on the spectrum now. So we are altering our biological terrain with chronic stress, trauma, poor food quality. We know that stress while a woman is pregnant totally impacts the fetus. And that you are more likely to have a child with behavioral issues. So there's a lot of reasons why we have more kids. And ultimately it's about that we are not healthy as a culture, you know, and stress is a huge part of that. And you talked about isolation. You know, I think of isolation as a massive feeder to stress and mental health issues, you know? So, you know, we have to take care of ourselves. Like we are all trying to run on empty, and stress can be good or bad, people. You can be doing great things and maxed out.
Yeah. And just,
you know? And I think that's surprising to people.
Yeah, no. And yeah, stress attributes to 85 to 90% of all disease processes.
And 70% of all visits to a physician are stress related.
Yeah. And then you won't really get talked to about it because they're on the clock. They got 10 patients.
And they're going to chase down symptoms. What is the symptom? Like, where's the holistic part? You know, everyone always comes to me and they're like, how come you're the only person that put it all together? And I'm like, okay, I know I'm smart, but I'm not that smart. I'm just as smart as your, you know, endocrinologist, you know, your GP. You have to take a systems approach. And when you do, then, you know, and you stop isolating the symptoms and you look at how they're connecting, we can get to these root causes and we can educate people. You know, so much can be done through lifestyle. And I never want people to think that that means that you are causing this, that it's 100% you. No, this is what's happening to your brain and body. So let's look at what's happening to the brain and body, why it's breaking down, and let's go through and strategically make those changes. So, you know, get over the magic wand, get over the magic pill. It's not happening.
I love it. Speaking of happening, you've made such a tremendous impact on Mike and I and all the listeners, and obviously everybody that has the good fortune of having you in their presence. And that leads me to the last thing that I'll ask you about is legacy. John Austin has an incredible quote that I love. The only thing you take with you when you're gone is what you leave behind. What is it that you want your patients, your families, your personal family to know when your time comes? What do you want them to feel about their time with you?
You know, I guess ultimately safe and loved, you know, and that trust, that, you know, that trifecta of that, you know what I mean? That I know, you know, I say to my youngest is really funny. And both my boys are funny, but my older one is 16. So he's just getting to the other side of the crabbiness. He's actually totally on the other side of the crabbiness. But my 10-year-old came out is like a 50-year-old. Like he just came out like that. So I always am like, wow. I mean, you must walk around being like, I am so loved. He's like, yeah. I am, you know, and I just think that's freaking awesome. You know what I mean? So like, just for people to feel safe, I know that I really work very hard, you know, as a special needs mom. My oldest, I got involved in Lyme disease long before my own kid had it and got PANDAS, and it is awful. I wouldn't wish it for my worst enemy. So I work really hard to have them trust again and to believe and have that safety. Because it is scary out there when your kid is struggling. You don't know what to do, who to trust. You don't know. So I know that's something that connection is so important, and that's where those pieces bring that connection. So I think that's what I would want my kid. I want my kids to be like, my mom loved me. You know, they also say mom and dad are so ridiculously funny. So I think that's important too, but humor can bring the other stuff. So joyfulness and humor are just an integral part of my everyday life. And I think it just makes life so much richer. You know, I think I'm super serious about what I do, but I also know that we just have to lighten up too. You know, so
I love it. Listeners, yeah, if you have any of these challenges that we've been talking about going on in your family, friends, neighbors, anybody that you know, again, reach out to drroseann.com. And again, drroseann.com or childrensmentalhealth.com. This has been an amazing episode. So much knowledge being dropped, just genuine. You can just see it oozing out of your whole body and your beautiful smile. And Mike and I really thank you for sharing your expertise with our listeners. Pasho has got a few closing comments, and then we'll be done with another episode. Pashito.
Yeah, Dr. Roseann, thank you. I was just sitting here soaking it all up. Wow, that's a lot of knowledge. That was more than just a little impressive. That was incredibly impressive. Thank you for sharing, and thank you for sharing that gift with the world. Appreciate it. And thank you for being on the show.
Thank you for the conversation. So this was good. And, you know, and I like to say to everybody, it's going to be okay. You just have to believe. And then you got to move your butt and you got to take action.
That's right. And speaking of taking,
I say that with love.
That's what I'm talking about.
You know, so
I was just going to throw in one quick joke. Mary Star of the Sea, where my Pasha is coaching, Dr. Roseann is coming over to teach you a crossover behind the back, little Euro step layup. So be ready for that. Last piece that I'll give you, Dr. Roseann, is there anything Mike or I should have been, why don't you guys talk to me about this or ask me this? Any last thing, or do you think we got it all?
Listen, this could be a 6-hour podcast with you guys, I could tell. So I think we got what people needed to hear. And I think the takeaway lesson really is to, you know, hold the vision of what you want for yourself, for your child and your family, and then take little actions, right? Towards that is so, so important. Don't ever give up.
I love it. Thanks again, listeners, for tuning in to another episode of Life's Essential Ingredients. It's been my Pasho and Dr. Roseann Capanna-Hodge dropping knowledge. Boom, we're out.